My name is David Erickson. I oversee the community development function here at the Federal Reserve Bank of New York. I don't think I'm going to say anything very controversial, but I just want to remind everyone that what I do say are views are my own and don't represent the Federal Reserve Bank of New York or the Federal Reserve System. This event, in case you're playing hooky from work or what have you, is being recorded. So keep an eye on the cameras. We're simulcasting it now, and we'll have it available on our website after the event. There are restrooms. You walked past them on this floor where I'm standing. There are also restrooms if you go through those double doors back into towards the center of the building. So there are no breaks in this event. We are going to march you through 3 unbelievably great panels. I should say the agenda is totally unworkable. There is not enough time for everybody to actually participate. But all the speakers know to keep their comments to 3 minutes and 30 seconds each. So we're going to get everyone's ideas out on the table. And as another way of saving a little bit of time, the moderators will not introduce their panelists other than by name and title. You have their bios in your packet here, okay? So I should say that this is, I think we did a tally. The first health and community development conference that we did in partnership with the Robert Wood Johnson Foundation was in July of 2010. And I think we were trying to tally them up. I think this is the 49th event of that type. And we're just thrilled to be doing this in New York City, my new home. I just moved here 3 months ago, so I'm very excited to be here. Woo! That's right. And one of the things that, it's interesting, I have always thought that this idea that we could radically improve the health of our communities by making sure they were more opportunity rich and people had the resources they needed to really to take control of their economic future. That I thought that would happen in a rural place. I thought that happened in a smaller, a simpler place. But I'm just kind of amazed at how much brain power there is here in New York City, where you basically have people finishing each other's sentences. This is a very sophisticated audience. This is a very sophisticated community. And I think people get this idea that health and wealth are connected. And so I'm so excited that you guys are here to have this conversation. I want to just draw your attention to the title of the event. It's Healthy Communities Conference Series. I want to underscore series because this is just the beginning of a conversation. We're going to have more of these events in the coming year. But the second title here is New Sources of Place-Based Capital to Improve the Upstream Social Determinants of Health. And we were talking to our communications team about this, and they basically said, all of those words are confusing. So I'm not sure this is very helpful. So what we're trying to do really, in essence, is to think about ways in which we have institutions that make investments in neighborhoods and places. Banks do this, hospitals do this, big anchor institutions do this. And what we're trying to figure out is how we can sort of take some of that funding and investing and really focus on what we think are the upstream social determinants of health. Having a safe, affordable place to live, having access to good schools, having a grocery store in a place that maybe had been a food desert before, having a job, reading at grade level. These are the things that we know powerfully influence your health. And so the trick is to sort of figure out how you can get sort of the people who have the money to invest into the hands of the people who could make those differences on those upstream factors, and who are the connectors to bridge those two communities and make that market work. So that is really what the whole day is really dedicated to, this idea. Just to go through the panels very quickly, the first panel is Health and Community Development Investing in Neighborhoods, and this is going to be an example, and in order to save time, we've already got them ready, spring-loaded, ready to go. But basically, this is an idea that, in the very early days of this effort, when I said that about 10 years ago, we would do heat maps, and we would highlight areas that would be of interest to the people who are doing community development, anti-poverty work, and certain neighborhoods would light up. in whatever community we're in. This was true at every place we went. And then we would do a heat map of something that would be interesting to the health community. So maybe it would be prevalence of childhood obesity, or it might be chronic disease, and certain neighborhoods would light up. And it's not by any accident you can imagine that in all of those places, those are all the same maps, right? And we were working side by side, but we don't really know each other. And so everyone got that. Like, intellectually, everyone just gets that. But what do you do about it? How do you actually sort of change those realities on the ground? So one way that is beginning to change is that hospital systems and banks and nonprofit banks, we call community development financial institutions, are now commingling, co-investing their funds in those communities that were lighting up as problem areas for both sectors to tackle the root problems, whether it's housing, jobs, education, et cetera. So the first panel is going to be a fantastic example of that. RWJ Barnabas in Newark, working with New Jersey Community Capital and JP Morgan Chase, hospitals and banks investing together, panel one. Panel two is really focusing on this idea about anchor institutions. Now, when we think about anchor institutions, these are institutions that can't pick up and move their manufacturing offshore or something like that, right? These are like hospitals, universities, places that are just they're rooted in their communities. And that panel is going to be talking a bit about sort of the classic strategies about how to create more opportunities and improve the social determinants of health in a place, whether it's through their procurement, fostering small businesses in their communities, or perhaps it's hiring local. But there's also kind of it's an anchor plus discussion. What other things can those institutions do to promote health in the communities where they're rooted? And the final panel was really an effort at trying to think, what's the next generation of some of this work? We know that we know that there are these institutions and these entities that are able to sort of pay for more housing, or pay for better health, rather. Health systems, foundations, the government are in a position to pay for better health, but there is not yet this sort of marketplace where the producers of health can really sort of, where it's a well-functioning marketplace. And so we thought, well, let's just do a thought experiment about how this might work in a place. And we decided, and this was Rosa Gill's thought, that we'll just start with a conversation around the Bronx. Now, as soon as we did that, people from Brooklyn were very angry. So, so I just want to let you know that we are definitely going to keep this conversation going with all the different neighborhoods, and we intend to. This is part of the series idea. These will be smaller events in the course of the year where we try to convene people at a more local level. But so for those of you who do not live in the Bronx, you are not going to be left out. You're going to be part of this conference series, I promise. So with that, again, my apologies for getting you guys into the building late. The Federal Reserve, we generally run a very tight ship, so we don't like starting late, but we're going to just slip the agenda slightly. And at the moment, I'm going to hand this over to everybody works for Rosa Gill in this building. She is the vice chair of our board of directors and president and CEO of Comunilife, a nonprofit focusing on improving health in New York City. And so I'm going to introduce Rosa to you right now.
Thank you so much for being here today, and I'm delighted to welcome you on behalf of the Board of Directors of the Federal Reserve Bank of New York, District 2, to this first, underscore first, Health Community Conference, because as David mentioned, we are going to have many more down the pipe. Listen, we live here in the richest city in the world that is the residence of world-renowned financial and banking institutions, and also home to so many state-of-the-art hospital system, medical research, training, and higher education institutions, an array of ambulatory care clinics, social service organizations. However, despite all of these rich institutional resources, we still have the Bronx County, which is the poorest county in the state, with very low health outcome and high prevalence of chronic diseases that takes a human and financial toll. These neighborhoods are the evidence of wealth and population health inequalities in our great city. Health outcomes will continue to impede the economic growth in some neighborhoods which are home to racial and ethnic groups due to the social, economic, cultural, and environmental conditions that create the inequalities in housing, inequalities in healthcare access, employment, education, poverty, agriculture, and food production in these communities. This afternoon, we are so fortunate to have so many distinguished panelists, key leaders to join us with a sense of urgency to make sure that every New York City neighborhood, including Brooklyn, is part of the healthier community with high economic performances and healthy outcomes. We thank you for being here because all of you, each of you in this room, you're a critical stakeholder in bringing resources to achieve these goals. Actually, down 37 floors below is the gold vault, but there's more gold of brain in this room than any place else. And yours, I'm not even 5 feet tall, therefore I need big shoulders and help to achieve this goal that we have set up together with David and the board of directors and the executive team. Thank you so much and enjoy the conference.